And we will come to order. Clerk, please call the roll.
Madam Chair, you have a quorum.
Thank you. So today we have 29 bills on the docket, and first we're going to take up 2 bills that will be directly re-referred to another committee, and then next we will hear from our subcommittee chairs to give a report on the bills that were heard in their respective subcommittees during this past week and that are now before this committee for consideration. And members, at your seat, you're going to find packets that contain any substitutes or amendments that were adopted by the subcommittee, and every bill that went through a subcommittee had the opportunity for public testimony, so we will not be hearing any additional public testimony this morning for the bills today. However, if there are questions that arise and we need to hear from the patrons will be invited to speak and address those concerns. And if your bill, patrons, if your bill received a unanimous positive recommendation for a subcommittee, your attendance is not required here today. However, we will contact you if your bill hits any unforeseen roadblock. So with that, let's go ahead and get started. The first bill is SJR 49, and we should re-refer this particular bill to our Rules Committee. Is there a motion?
So moved.
It's been moved and seconded that SJR 49 be re-referred to Rules. Clerk will, clerk will open the roll.
Ayes 14, no zero.
SJR 49 has been re-referred to Rules. The second bill is SB 278, and we will be re-referring that bill to Courts of Justice. Is there a motion?
So moved. Second.
It's been moved and seconded that SB 278 be re-referred to Courts of Justice. Clerk will open the roll.
Ayes 14, no zero.
Thank you. SB 278 has been re-referred to Courts of Justice. SB 716 now has a substitute which puts it more directly within the scope of this committee. So instead of re-referring it to Courts of Justice, it will be taken up tomorrow in our subcommittee on health professions. So we will not take any action on SB 716 this morning. We're now ready for our subcommittee reports from our subcommittee chairs, and Senator Van Valkenburg has asked to present his subcommittee report first so that he may join another committee that will be in progress soon.
Thank you, Madam Chair. Madam Chair and members of the committee, first up is Senate Bill 54, patroned by Senator Locke, about the Virginia Preschool Initiative. First, we need to move the substitute.
Second.
It's been moved and seconded. The substitute has been moved and seconded. All in favor?
Aye.
Any opposed? The substitute is in front of us.
Thank you, Madam Chair. The substitute makes various changes to increase the specificity of certain requirements relating to the determination of the funding formula required pursuant to the bill, family eligibility requirements and requirements for assessment of a copayment for the provision of certain services and requirements relating to the use and distribution of these VPI funds. We recommended reporting with substitute on a 5-0 vote, and I so move.
Second.
Re-refer to Finance.
And re-refer to Finance. Yep.
It's been moved and seconded that SB 54 be reported and re-referred to Finance. Is there any discussion from committee members? And I would just remind all committee members to use the electronic queue. Seeing no comments, the bill is in front of us. The motion is in front of us. Clerk will open the roll.
Ayes 15, no zero.
Thank you. SB 54 has been reported and re-referred to Finance. Senator Van Valkenburg.
Thank you, Madam Chair. Next up is Senate Bill 139, patroned by Senator Carol Foy, which was to direct the board to swap out world languages for career and technical ed for the advanced diploma. We recommended passing by indefinitely and sending a letter to the Board of Education to look at this issue from an accreditation perspective, knowing that the Board of Education is already in that accreditation process, rather than kind of coming here and tinkering legislatively. And so I would move that we pass by indefinitely and that the chair send a letter to the Board of Education.
Second.
It's been moved and seconded that SB 139 be passed by indefinitely with a letter from the chair to the Board of Education. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 14, noes 1.
Thank you. SB 139 has been passed by indefinitely with a letter from the chair to the Board of Education. Senator Van Valkenburg.
Thank you, Madam Chair. Senate Bill 161 from Senator McGuire is literally the same as Senate Bill 139, except rather than foreign language, it's lab science, and we made the same exact recommendation. So I would move that we pass by indefinitely with a letter to the Board of Education.
Second.
It's been moved and seconded that SB 161 be passed by indefinitely with a letter from the chair to the Board of Education. Is there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 13, noes 2.
Thank you. SB 161 has been passed by indefinitely with a letter from the chair to the Board of Education. Senator Van Valkenburg, your next bill.
Thank you, Madam Chair. Next bill is Senate Bill 170 from Senator Craig, and she asked that we continue it to 2025, and so we made the recommendation to continue to 2025 on a 5-0 vote, and I so move.
Second.
It's been moved and seconded that SB 170 be moved to continue to 2025. Is there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 15, noes 0.
Senator, your next bill.
Thank you, Madam Chair. Next up is your Senate Bill 235, which provides that nothing in the law requiring the Department of Education to develop and make available to each school board model policies for ensuring parental notification of any instructional material that includes sexually explicit content and requiring each school board to adopt policies that are consistent with, but may be more comprehensive than, such model policies, or that is in such model policies or school board policies, shall be construed to permit the censoring of books in any public elementary or secondary school. And to put that in plain English, what this bill does is take what was in an enactment clause in the original bill and put it into the law to clarify that localities may not use this model policy language to ban books. And we recommended reporting on a 3-2 vote, and I so move.
Second.
It's been moved and seconded that SB 235 be reported. And are there any comments from committee? Seeing none, clerk will open the roll.
Ayes 9, noes 6.
Thank you. SB 235 has been reported. Senator Van Valkenburg, the next bill.
Thank you, Madam Chair. Next up is Senator Sturdivant's Senate Bill 380. It requires each school board to create a process allowing a qualified student, as defined in the bill, to access funding set aside for alternative educational opportunities as defined in the bill. The bill provides that the school boards must also determine if the alternative educational program qualifies as a mean to earn class credit or to satisfy a graduation requirement. The motion to recommend reporting failed on a 2-3 vote, and so I would move that we pass by indefinitely.
Second.
Thank you. It's been moved and seconded that this bill, SB 380, be passed by indefinitely. Are there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 9, noes 6.
SB 380 has been passed by indefinitely. Senator, your next bill.
Thank you, Madam Chair, members of the committee. Next up is Senator Sturtevant's Senate Bill 421, which establishes the Foster Child Scholarship Program to be administered by the Department of Education for the purposes of providing school-age children in foster care the option to attend the participating public or private school of their caregiver's choice. You can see in the summary that it then lists a whole bunch of different pieces to this, which I'm not going to read. But the motion to recommend reporting failed 2 to 3, and so I would move that we pass by indefinitely.
Second.
It's been moved and seconded that SB 421 be passed by indefinitely. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 10, noes 5.
SB 421 has been passed by indefinitely. Senator, your next bill.
Thank you, Madam Chair. Next up is Senate Bill 431 from Senator Suderline, and first I would move the substitute.
Second.
It's been moved and seconded that we adopt the substitute. All in favor, say aye.
Aye.
Any opposition? The substitute has been adopted.
Thank you, Madam Chair. Members of the committee, the substitute ensures that the provisions relating to the provision of certain alternative forms of pupil transportation are permissive and adds language clarifying that the annual reporting requirement relating to the costs and use of pupil transportation for each local school division applies only to the school divisions that choose to provide pupil transportation pursuant to the provisions of the bill. Finally, the substitute eliminates the provision permitting school boards to use a portion of its transportation funding to provide grants to parents who provide school transportation to and from school, and eliminates the accompanying provisions relating to liability insurance and policy relating to those grants. And this is, to kind of boil this one down into plain English, is a bill to help school systems that are having transportation problems have alternative transportation options. We recommended reporting the substitute on a 5-0 vote, and I so move.
And re-refer to finance.
Does it have a letter?
There is a
Okay.
re-refer.
So the recommendation would be reporting the substitute and then re-referring to finance.
Second.
The chair of finance is quite happy with your. So SB 431 has been recommended for reporting as substituted with a referral to finance. Is there any discussion on this bill? Seeing none, clerk will open the roll.
Ayes 15, no 0.
Thank you. SB 431 has been reported as with the substitute and re-referred to finance. Senator Van Valkenburg.
Thank you, Madam Chair. Madam Chair, members of the committee, next up is Senate Bill 533 from Senator Jordan, which creates the Education Excellence for All program. It permits the parents of qualified students defined in the bill to apply for a 1-year renewable Education Excellence for All savings account, which is defined in the bill, that consists of an amount that is equivalent to a certain percentage of all applicable annual standards of qualities per pupil state funds appropriated for public school purposes and apportioned to the school division in which the qualified student resides, including the per pupil share of state sales tax funding and basic aid, say that 10 times fast, and any per pupil share of state special education funding for which the qualified student is eligible. I deserve a round of applause for that sentence. The bill permits the parent of the qualified student to use the monies in such account for certain qualified expenses of the qualified student, including tuition, deposits, fees, and required textbooks at a private elementary school or secondary school that is located in the Commonwealth. The motion to recommend reporting failed on a 2-3 vote, and so I would move that we pass by indefinitely.
Second.
Sorry, my mic was off. SB 533 has been recommended to pass by indefinitely and seconded. Are there any discussions around this bill? Clerk will open the roll.
Ayes 9, no 6.
SB 533 has been passed by indefinitely. the next bill, Senator.
Thank you, Madam Chair. And this is the end. Senate Bill 558 from Senator to staff creates school choice educational savings accounts and permits the parents of qualified students to apply to the Department of Education for a renewable school choice education savings account consisting of a monetary amount that is equivalent to a certain percentage of all applicable annual standards of quality per pupil state funds appropriated for public school purposes and apportioned to the resident school division in which the qualified student resides. It then lays out a whole bunch of qualifications that I'm not going to read. It's similar to, but different from Senator Jordan's bill. We recommended, the motion to recommend reporting failed 2 to 3, so I would move that we pass by indefinitely.
Second.
It's been moved and seconded that SB 558 be passed by indefinitely. Is there any discussion on this bill? Seeing none, clerk will open the roll.
Ayes 9, noes 6.
SB 558 has been passed by indefinitely. Senator Van Valkenburg, thank you to you and your subcommittee for this weighty docket, and thank you for reporting it to us.
We'll be back with many more, Madam Chair. Many more. Thank you.
We look forward to it. Thank you. So we will go back then to our beginning, and we will hear next from Health Professions with Subcommittee Chair Senator Boysko.
Thank you, Madam Chair. One group that is in the room who didn't get an introduction is the Certified Registered Nurse Anesthetist students from VCU. They are members of VANA, and I ask that we give them a warm welcome. So SB 22, patron is Senator Locke. We have an amendment, and I move the amendments.
Second.
It's been moved and seconded that we adopt the amendment. All in favor?
Aye.
Any opposed? The amendment has been adopted.
Madam Chair, the amendments make identical changes in 2 places by replacing the term leading to with the term resulting in reference to certain dental education programs resulting in the Doctor of Dental Surgery or Doctor of Dental Medicine degree. This is the Dentist, Dental, and Dental Hygienist Compact. It authorizes Virginia to become a signatory to the Dentist and Dental Hygienist Compact, The compact increases public access to dental services by permitting eligible licensed dentists and dental hygienists to practice in the compact participating in states, provided that they are licensed in at least one participating state. The compact has been passed in 3 states and takes effect when it is enacted by a 7th participating state upon the effective date of this bill, whichever is later. And I so move.
Madam Chair. if
Oh, yes, ma'am.
There's a technical,
I think it has to be referred to finance.
there's a technical amendment that we also have to adopt for SB 22,
Oh, thank you very much. I didn't
line
know.
714. After the word code, we will insert of.
I so move.
Second.
It's been moved and seconded that we adopt that technical amendment as well. All in favor?
Aye.
Any opposed? The technical amendment has also been adopted. And I would welcome your first motion.
Yes, ma'am. I move that we report with amendments and we refer to finance, I believe. Is that correct? Did this need to go to?
Second.
Second.
It's been moved and seconded that we report SB 22 as amended and re-refer it to finance. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no 0.
SB 22 has been reported as amended and re-referred to finance.
Thank you,
Chair.
Madam Chair. Excuse me. SB 33 also has a substitute. I move the substitute.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Aye.
Any opposed? The substitute has been adopted.
Madam Chair, the substitute directs the work group convened by the bill to evaluate, in addition to factors and impacts enumerated in the original bill, how potential changes to law regarding the practice of certified registered nurse anesthetists will impact the patients in historically economically disadvantaged communities and underserved areas, whether such potential changes would increase or decrease health disparities. Senator Locke brought forward supervision of certified registered nurse anesthetists work group, and report clarifies that the supervision of certified registered nurse anesthetists requires that a licensed doctor of medicine, osteopathy, podiatry, or dentistry is present during the operation or procedure or is immediately available to respond and provide patient care as needed. The bill directs the Secretary of Health and Human Resources, in collaboration with the Board of Medicine, Board of Nursing, and Department of Health Professions, to convene a work group of relevant stakeholders to evaluate and make recommendations to increase the anesthesia provider workforce in the Commonwealth. The bill requires the work group to report its recommendations to the chairman of the Senate Committee of Education and Health and the House Committee on Health, Welfare, and Institutions by November 1st, 2024. It was recommended reporting the substitute, 3 yes, 2 abstentions, and 0 ones, and I so move.
It's been moved and seconded that SB 33 be reported. Is there any discussion from the committee? Clerk will open the roll.
Ayes 11, noes 2, 2 abstentions.
SB 33 has been reported as amended.
Madam Chair, SB 35, patron also Senator Locke, Board of Medicine of Board of Nursing, Continuing Education, Continued Competency, Unconscious Bias, and
Senator
Culture.
Boyska, I believe there's a substitute for SB 35.
I must be looking at an old form here, excuse me. I move the substitute.
Is there a second?
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Aye.
Any opposition? The substitute is in front of us.
Madam Chair, the substitute expands the factors and impacts that the work group is directed to assess in evaluating and making recommendations on increasing anesthesia providers' workforce in the Commonwealth by directing the work group additionally assess how potential changes to current law regarding the practice of certified nurse anesthetists will impact historically disadvantaged communities and underserved areas. Am I reading the right one? It's 35. My apology. I didn't have my coffee today. Okay. Madam Chair, the board, this directs the Board of Medicine and the board.
The patron would like to speak to the bill.
Thank you.
When we initially put this in, it came with a fist of over $600,000. So in order to eliminate that amount of money, because that came as a surprise, quite frankly, we did this substitute to remove the need for having to put in that amount of money for what we thought wasn't necessary. So essentially what the substitute does is to put in the Board of Medicine as the agency, as well as the Virginia Neonatal Perinatal Collaborative, to be responsible for the training in unconscious bias and cultural competency as part of the continuing education and continuing competency requirements for licensure. And that's essentially what the change is.
Thank you, Senator Locke. Senator Boyska?
Madam Chair, the bill was recommended, or the bill was recommended for 0, and I move this. I recommend it needs to go to finance. I move the substitute with the re-referral to finance.
Second.
It's been moved and seconded that SB 35 be be reported as substituted with a re-referral to finance. Is there any discussion from committee? Clerk will open the roll.
Ayes 10, noes 5.
Thank you. SB 35 has been reported as amended and re-referred to finance. Your next bill, Senator?
Thank you, Madam Chair. SB 239 is Senator Hashmi's bill, your bill. It is the Social Work Licensure Compact, authorizing Virginia to become a signatory to the Social Work Licensure Compact. The compact allows social workers who have been or are eligible for an active unencumbered license in the compact or member state where they reside for multi-state license. After verifying eligibility, the social worker is granted a multi-state license that authorizes practice in all other compact member states. The compact takes effect when it is enacted by the 7th member state. It was recommended reporting 5-0 and we need to re-refer to finance, and I so move.
Second.
It's been moved and seconded that we report and re-refer to finance SB 239. Is there any discussion from the committee? Seeing none, clerk will open the roll.
Ayes 15, no 0.
Thank you. SB 239 has been reported and re-referred to finance. Senator Boysko.
Yes, Madam Chair, SB 537, Patroness Bagby, Board of Health Regulations, use of smoke detector evacuation systems during surgical procedures. It requires the Board of Health to amend its regulations to require that every hospital where surgical procedures are performed to adopt a policy regarding the use of smoke evacuation systems for all planned surgicals. The substitute makes 2 modifications to the bill. First, the substitute adds a delayed enactment clause of July 1st, 2025. The second makes technical changes necessitated by the addition of the delayed enactment clause by removing the first 2 sections of the amended bill because that version is set to expire on July 25. The date on which the bill is amended by a delayed enactment clause is set to go into effect. The second version of the section set out on the bill is set to go into effect on July 1st, 2025. Therefore, the result of the delayed enactment clause is amending the first version of the section is no longer necessary, as that version will have expired by the time it goes into effect. Recommended reporting the substitute with 5-0, and I so move.
Adopt the substitute.
We need to adopt the substitute first.
Substitute.
I move adoption of the substitute.
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
The substitute is in front of us as already detailed by Senator Boysko. Do you have another motion,
I
Senator
so
Boysko?
move with the substitute be reported.
Second.
It's been recommended, it has been, the motion is to report SB 537 as substituted, and is there any discussion? Clerk will open the roll.
Ayes 15, no 0.
Thank you. SB 537 has been reported with substitute.
Madam Chair, the final bill, and I'm going to try to get this all right. I think it's a simple one. SB 629, Patroness Pillion, gives civil immunity, dentist and dental hygienist, mental health treatment for healthcare professionals, reporting requirements. This adds dentists and dental hygienists to the list of professionals who are immune from civil liability for any act done and or made in performance of his duties while serving as a member of or consultant of an entity that functions primarily to review, evaluate, or make recommendations on a professional program to address issues related to career fatigue and wellness in healthcare professions. It also extends civil immunity to certain providers for any act done or made in performance of his duty while serving as a member of the consultant as to an entity that functions primarily to arrange for or provide outpatient care for healthcare providers. It also revises the Board of Medicine reporting requirements when a healthcare professional is admitted for mental health treatment. Under the bill, if a healthcare professional is voluntarily admitted to a healthcare institution for treatment of a substance abuse or psychiatric illness and is no longer believed to be a danger within 30 days, then no report will be made to the Board of Medicine. And Madam Chair, it was recommended reporting 5-0, and I so move.
It's been moved and seconded that SB 629 be reported. Senator, in the subcommittee, was there any discussion around the qualifications of the patron to present this bill?
Madam Chair, I vouch for the patron.
Understood. The patron has been vouched for. There's a motion in front of us. Is there any further discussion? If not, clerk will open the roll.
Ayes 15, no 0.
Thank you, Senator Boysko. SB 629 has been reported from the committee. Thank you, Senator Boysko, for your subcommittee report. Our next subcommittee report is from Chair Senator Favola on the Health Subcommittee.
Thank you, Madam Chair. I draw your attention to Senate Bill 24. Patron was Senator Locke. And this is a long-term services and supports screening bill. An expedited screening is also part of this bill, along with screening flexibility. There was an amendment to this bill, and the word only was added after the phrase discharged to a nursing facility for skilled care. I move the amendment.
Second.
It's been moved and seconded that we adopt the amendment. All in favor?
Aye.
Any opposed? The amendment has been adopted.
Thank you, Madam Chair. So this bill modifies existing provisions regarding the required long-term services and supports screening under our state plan for medical assistance, and it creates greater flexibility for how the screenings are completed under certain circumstances. The bill is recommended reporting with the amendment of 5-0, and I so move.
Second.
It's been moved and seconded that we report SB 24 as amended. Is there any discussion from committee? Clerk will open the roll.
Ayes 15, no 0.
Thank you. SB 24 has been reported as amended. Senator Favola.
I turn your attention to Senate Bill 179. The patron was Senator Favola, and this deals with state hospitals and discharge planning. What this bill does is it establishes a pilot program which would allow state psychiatric facilities and hospitals, if they have patients that are there for 30 days or less, these hospitals would be in charge of the discharge planning. And three
Do you want to move
hospitals
the substitute?
I'm going to get to the substitute. A substitute was offered to explain the pilot as I just presented, and the substitute actually refers to specifically naming the three sites for the pilot project: Central State Hospital, Southwestern Virginia Mental Health Institute, or Southern Virginia Mental Health Institute. This was a recommendation from the Behavioral Health Commission, and the JLARC also did a study. Our goal is to ensure a more seamless discharge process, and that was the purpose of the bill, and I move that the substitute be adopted.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposed? The substitute has been adopted.
Madam Chair, I move that the bill be reported with the substitute. Has the committee recommended a 5-0, and it has to be re-referred to Finance.
Is there a second?
Second.
It's been moved and seconded that SB 179 be reported as with the substitute and re-referred to Finance. Is there any discussion from committee? Clerk will open the roll.
Okay,
15,
next
no zero.
bill.
Clerk.
Ayes 15, no zero.
Thank you. SB 179 has been reported and as amended and re-referred to Finance. Senator Favola.
Draw your attention to Senate Bill 229, patron with Senator Hashmi. And this is an advisory council on breakthrough therapies for veteran suicide prevention. So this bill establishes an advisory council on breakthrough therapies for veteran suicide prevention to advise the state health commissioner on regulations and infrastructure necessary to support clinical access to and provider training for the use of rapid-acting therapies that have been granted breakthrough therapy designation by the U.S. Food and Drug Administration. This should help with the treatment of post-traumatic stress disorders and major depressive disorders. The bill requires the state health commissioner to report annually by December 1st to the governor and the General Assembly regarding its recommendations. The council sunsets on July 1, 2027. It was the recommendation of the committee that this bill be reported by a 4-1 vote, and it needs to be re-referred to Finance. I so move that the bill be reported and re-referred to Finance.
Second.
Thank you. Thank you. SB 229 is recommended for reporting and re-refer to Finance. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 14, noes 1.
Thank you. SB 229 has been reported and re-referred to Finance. Next bill, Senator Favola.
Next bill is Senate Bill 280. Patron is Senator Hashmi. This bill actually had a substitute, and it made a technical amendment by replacing throughout the bill each reference to the term terminal condition with the term terminal disease in conformity with the bill. And I so move that the substitute be adopted.
Is there a second? It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? The substitute has been adopted.
The bill with a substitute actually provides for decision-making at the end of life. This bill allows an adult diagnosed with a terminal condition to request an attending healthcare provider to prescribe a self-administered controlled substance for the purpose of ending the patient's life. The bill requires that a patient's request for a self-administered controlled substance to end his life must be given orally on 2 occasions and in writing, signed by the patient and 1 witness, and that the patient be given an express opportunity to rescind his request at any time. The bill makes it a Class 2 felony to willfully and deliberately alter, forge, conceal, or destroy a patient's request or rescission of request for a self-administered controlled substance to end his life, or to coerce, intimidate, or exert undue influence on a patient to request a self-administered controlled substance, or to coerce, intimidate, or exert undue influence on a patient to forego a self-administered controlled substance. This bill also grants immunity from civil or criminal liability and professional disciplinary action to any person who complies with the provisions of the bill and allows healthcare providers to refuse to participate in the provision of a self-administered controlled substance to a patient for the purpose of ending the patient's life. Madam Chair, we had a very robust hearing on this. There were many speakers, and this bill got a full airing. It is the recommendation of the committee that the bill report on a 3-2 vote and that it be re-referred to Finance. I move that the bill report with the substitute and be re-referred to Finance.
Second.
Thank you. It's been recommended that we report as substituted and re-refer to Finance, SB 280. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 8, noes 6, 1 abstention.
Thank you. SB 280 has reported with the substitute and is re-referred to Finance. Senator Favola.
Madam Chair, I draw your attention to Senate Bill 392. The patron is Senator Pekarsky. There is an amendment. It adds a delayed enactment clause of January 1, 2025. I ask that the amendment be adopted.
Is there a second?
Second.
It's been moved and seconded that we adopt the amendment. All in favor?
Aye.
Any opposition? The amendment is in front of us.
Thank you, Madam Chair. What this does, it deals with emergency departments and licensed physicians. So it requires any hospital with an emergency department to have at least one licensed physician on duty and physically present at all times. Current law requires such hospitals to have a licensed physician on call, though not necessarily present. This would change that. At least one physician would have to be present at all times. The amendment adds delayed enactment clause of January 1, 2025. The committee reported this bill has amended by a 5-0 vote. I move that the committee report the bill as amended and re-referred to Finance.
Is there a second?
Second.
It's been moved and seconded that we report the bill as amended and re-refer to Finance. Is there any discussion on SB 392? Seeing none, clerk will open the roll.
Ayes 15, no 0.
SB 392 has been reported as amended and re-referred to Finance. Thank you. Senator Favola.
Thank you, Madam Chair. I have my last bill from the committee is Senate Bill 620. The patron was Senator Pillion. This has to do with long-term services and support screening for the PACE program. This bill allows qualified staff of programs of all-inclusive care for the elderly, or the PACE program, to conduct the required long-term services and support screening in accordance with requirements established by DMAS. The bill directs the department to adopt emergency regulations to implement the provisions of the bill. Madam Chair, there was a substitute, and I move that the substitute be adopted.
Second.
It's been moved and seconded that we adopt the substitute. All in favor?
Aye.
Any opposition? The substitute has been adopted. Senator.
Madam Chair, the committee recommended that the bill be reported on a 5-0 vote. So I move that the bill be reported and that it be re-referred to Finance.
Second.
As substituted.
Yes, that the substitute be reported and re-referred to Finance.
Thank you. SB 620 is recommended for reporting with substitute and re-referred to Finance. Is there any discussion? Clerk will open the roll.
Ayes 15, no 0.
SB 620 is reported with substitute and re-referred to Finance.
That completes my report, Madam Chair.
Thank you, Senator Favola. That was a very comprehensive docket and appreciate your report. Our last subcommittee report is from the Chair of Higher Education, Senator Locke.
Thank you, Madam Chair. We begin with Senate Bill 21 from Senator Salim. This bill deals with public institutions of higher education and individuals with students with disabilities, and there is a substitute, and I move the substitute.
In addition to the substitute, there is an amendment to the substitute that the
I'm going to get to that one, too.
Okay. It's been,
Madam Chair,
just hang on a second. It's been moved and seconded that we adopt the substitute as it emerged from the committee. All in favor?
Aye.
Any opposed? The substitute has been adopted.
And there was an amendment to the substitute as well. Seconded.
It's
the
been
amendment.
it's been moved and seconded that we adopt the substitute. Would you like to speak to your amendment?
yes. On line 30, we're just substituting, striking out 2 and putting in 4, given that individuals who get the evaluation from a professional license practice they may get it but not use that 2 years period to go and get those services in the universities. So it's a friendly amendment, just a technical amendment.
Is this another amendment other than the one that we adopted in the committee?
It's,
Sorry.
Can you explain? Council can explain.
Thank you, Madam Chair. The line amendment that's being offered now amends the substitute that was adopted in subcommittee by changing the maximum amount of time prior to the student's application for admission to institution that a record or evaluation could be completed for the purposes of an institution of higher education determining whether the student is an individual with a disability. And it changes that length of time from 2 years, which was the length provided in the substitute, to 4 years. And also, Madam Chair, I just want to clarify that because the line amendment was prepared right before the full committee meeting started. That's why there aren't paper copies, but it is available online. Thank you.
Okay, because what was adopted in this committee was 2 years.
correct.
Okay, all right. Okay, Madam Chair, the committee, the bill requires each public institution of higher education to adopt a policy that makes certain documentation or evidence enumerated in the bill that is submitted by an enrolled or admitted student sufficient to establish that the student is an individual with a disability. What the substitute did was to clarify the scope of the policy that each public institution of higher education is required to adopt pursuant to the bill by specifying that the policy must establish as significant for establishing that the student is an individual with a disability. And again, the number of years has now changed from, it was initially 8 years, then in the committee we said 2 years, now it says 4 years.
Correct.
Okay.
Madam Chair, did we adopt the new substitute yet?
Have not yet. We need a motion to adopt the technical, I'm sorry.
I thought we just did that, because in this committee, we adopted 2 years, so now did we just adopt the
have
new
not
4
voted.
years?
We did not take a vote on it,
On
Council.
the 4 years? Okay, so we have the amendment. Okay, so I
Madam
move the
Chair.
amendment.
Just to clarify the exact timeline, in the subcommittee meeting, there was an initial substitute that was offered and adopted that did provide 8 years as that time frame. And then there was an amendment to that substitute that was offered in concept and adopted in the subcommittee meeting that changed it to 2 years. And then we just had a new line amendment to that second substitute offered here that is now up for consideration to change from 2 years to 4 years.
So what are we adopting, an amendment or a substitute?
Madam Chair, Senator Locke, we would be adopting the amendment to the substitute.
Okay.
Is there a motion?
I will,
I don't like the amendment, so go ahead.
okay, I was going to ask if the chair of the subcommittee had a opinion on the amendment.
I mean, we can go ahead and adopt the amendment, but I don't like it, but go ahead.
I believe Senator Head wishes to speak as well.
Well, yeah, Madam Chair, just wondering, clarifying, I mean, when we're talking about college admissions here in that, and the age of the students that would be affected in this, why do we need to go back that far for evaluation? Because things, I mean, I think 2 years was, I don't understand the need to go to 4. So,
Is this a question for the patron, Senator Head?
yes, it is, Madam Chair. Yeah.
Correct. If I can clarify on the years we
Senator
went back.
Salim.
Oh, sorry, Madam Chair, if I can clarify on the years we went back and forth, and we made the substitute in the subcommittee to do 2 years. However, between then and now, talking to the House companion bill, along with other organizations and the colleges, we realized that when it comes to an evaluation from a licensed professional, someone may get that evaluation, but when they get it, they may not apply to a university within that 2-year period. So in fairness, when we put the 2-year in, it actually puts a disadvantages on some of the students with the disability. It still leaves it up to the university's discretion to accept and ask for additional documentation.
Madam Chair, point of inquiry.
We have
sorry.
a queue somewhat, but Senator Head, did you have further?
Well, Madam Chair, I mean, I don't see that leaves it just no more than 4 years. I mean, it just spreads it on back. And I mean, if it were shorter time frame than that, certainly. But I mean, the 2-year, I mean, my recommendation would be for somebody, if they haven't been evaluated in that length of time, to get another evaluation. That's not that difficult to do as they're coming in. And there are other things that they've got to do to get ready. And I'd just like to have something a little more timely. So would move that we not, I'm going to be voting against adopting that as an amendment. But
Thank you, Senator Head. Senator Favola.
Question for the patron or for general counsel. As I read the moving the 2 years to 4 years, it would effectively allow more individuals then to apply under, an IEP condition. Is that right? Because they wouldn't have, fewer people would probably go and get an evaluation within the 2 years, but more people may have had an evaluation within the past 4. I'm trying to figure out what the impact would be on the actual pool of applicants.
Madam Chair, Senator Favola, to answer that question, I would first clarify that the record or evaluation that is being discussed when we're discussing 2 years versus 4 years prior is simply for the purposes of a higher institution of higher education accepting documentation as sufficient evidence that the student is an individual with a disability. So it's not pertaining to transferring an IEP or any sort of 504 plan, because those typically don't apply after the applicable student has graduated from high school. And so the effect of this amendment would be saying that each institution of higher education, each public institution, shall adopt a policy that would make it such that a record or evaluation, as described in subdivision 4, is sufficient to establish that the student is an individual with a disability only if that record or evaluation was completed no more than 4 years prior to the student's application for admission, where the substitute initially says that that record or evaluation couldn't date back more than 2 years prior to the student's application. So it would potentially expand the opportunities for students to provide that documentation to try to establish that they're an individual with a disability, because if they were someone who, for example, had some type of insurance issue or had been evaluated more than 2 years prior to application, that documentation of a record or evaluation would be sufficient evidence for the institution. Whereas if it were 2 years, it would cut them off and they wouldn't be able to provide that record or evaluation.
Thank you, Counsel. And Senator Pekarsky?
Yeah, thank you. So the way I understand this, and please correct me if I'm wrong, because evaluations are expensive when you're pursuing this, especially privately, and by the time you're applying to a higher ed, it's unlikely that these, disabilities are going to change or significantly be different if you were reevaluated. And I think this is a way to really save money for people who cannot afford these very costly evaluations that are thousands of dollars, and insurances don't usually pay for them. So let me know if I'm misunderstanding the intention of this, please.
Madam Chair, and to the senator's point, that is correct. It is essentially making sure that if somebody does get the evaluation within a 2-year period or a 4-year period, they're not excluded from making sure that they submit their admissions, and a lot of times students will get the evaluation and forego within the first couple of years so that they don't have to go back and get themselves reevaluated. The disability does not go away. This is to ensure that they're not reevaluated often as such universities may require. And again, this does not take away from the fact that the universities can and still has the opportunity to ask for additional documentation.
Thank you. Seeing no other comments from committee, I think one other point, kind of piggybacking off of Senator Pekarsky, is the concern that some students may be taking a gap year as well and not necessarily enrolling in higher education immediately after high school. And so this would perhaps alleviate some of the financial burden on a student and family if they have a little bit longer window of time. We have not yet adopted the technical amendment. Is there a motion to adopt the technical amendment as relayed by council, changing from 2 years to 4 years? Is there a motion to adopt that and to second?
I think a motion was made, and I will second the motion.
Madam Chair. Madam Chair.
Senator
Is the technical amendment to go from 2 years to 4 years?
Yes.
That's a technical amendment, okay.
Is there, all in favor of the amendment from 2 years to 4 years, will say aye.
Aye.
Any opposition? No. The chair is uncertain. We will take a roll call vote.
Ayes 8, noes 7.
The amendment to change from 2 years to 4 years has been adopted. And Senator Locke, I'll return it to you.
Okay. It's hard to do this recommendation. It was recommended for reporting on a vote of 5-0, but that was based upon the previous 2 years. But I'll make the motion to recommend for reporting 5-0.
Second.
It's been recommended that the committee report the bill as substituted in addition to the amendment that we were just discussing and have just adopted. Is there any further discussion? Clerk will open the roll.
Ayes 8, noes 6, 1 abstention.
SB 21 has been reported as substituted and amended.
Thank you, Madam Chair.
Thank you. Senator Locke.
Next bill is Senate Bill 219 from Senator Sturtevant. This bill makes several changes to the Virginia National Guard Tuition Assistance Program to include making provisions relating to the requirements and conditions for eligibility for the award, as well as eliminating the requirement to satisfy financial obligations with the institution of higher education at the beginning of each semester, and simplifying the requirements relating to academic performance and good standing, and providing that any grant awarded shall be in an amount equivalent to the differences between the full cost of tuition and fees as the institution of higher education, less any other educational benefits for which an individual is eligible as a member of the National Guard. This was recommended for reporting with an amendment, and I move the amendment.
Second.
The amendment has been moved and seconded. All in favor?
Aye.
Any opposition? The amendment has been adopted.
And with that amendment, I move that the bill be reported as amended and re-referred to finance.
Is there a second? Second. It's been moved and seconded that we report SB 219 as amended and re-referred to finance. Is there any further discussion? Clerk will open the roll.
Ayes 15, no 0.
SB 219 has been reported with amendment and re-referred to finance. Senator Locke.
SB 279 has an amendment, and I move the amendment.
Second.
It's been moved and seconded that we adopt the amendment. All in favor?
Aye.
Any opposition? The amendment has been adopted.
SB 279 from Senator Sturtevant provided for several changes to the Virginia Commonwealth University Health System Authority. And it specifically reduces the number of members serving on the authority's board of directors and the number of physician faculty members that are required to serve on the board. It requires persons who are appointed by the Speaker of the House of Delegates and the Senate Committee on Rules to be non-legislative members, and changes the term of office for board members. After discussion, it was recommended that this bill be passed by indefinitely, and I so move.
It's been moved and seconded that SB 279 be passed by indefinitely. Are there any discussion points from the committee? Seeing none, clerk will open the roll.
Ayes 15, no 0.
SB 279 has been passed by indefinitely. Senator Locke.
Senate Bill 287 also comes from Senator Sturtevant. This bill authorizes the State Board of Community Colleges, with the approval of SHEV, to establish an upper division of any comprehensive community college to include a third and a fourth year of baccalaureate degree programs that would lead to occupations in a high demand field and confer baccalaureate degrees in those programs. And so after discussion, it was recommended that this bill be passed by indefinitely on a vote of 5-0, and I so move.
Second.
It's been moved and seconded that SB 287 be passed by indefinitely. Is there any discussion from committee? Seeing none, clerk will open the roll.
Ayes 15, no 0.
SB 287 has been passed by indefinitely, and I believe that...
That concludes my report.
Thank you, Senator Locke, for your report on the committee hearing. There are no further bills in our docket, and I thank everyone for their work in the subcommittees. And with that, we are adjourned.